Facebook. We are live on Facebook. Give me a second so I can, I'd like to share this also with my page, as you know. Let me make sure that happens. Terrific. Thanks everyone for joining us tonight. We'd like to get started. For those of you watching on Facebook, the video "We Will Fly Again," developed by Dutchess Tourism. Just a great reminder that we're going to get back on our feet, and it's going to happen soon. There's going to be a great deal of challenges, and this, of course, has been an enormous challenge for so many families, businesses, and others, whether impacted by COVID-19 or the pause, shutdown, stay-home orders that have been put in place. We appreciate the patience that you've had. We understand the anxiety and the stress that folks are dealing with. Believe me, we understand it. And tonight we'd like to continue our conversation with some updates, a little bit of status, and some initiatives that we're going to be taking over the course of the next several days. So if you're on the telephone town hall, those of you watching live on Facebook, if you would like to ask a question, just comment in the comment section below the live feed. If you're on the telephone call with us this evening, dial 0. When you dial 0, you'll be asked to record your question, and then we'll take as many as possible live. So if you have a question, dial 0. We want to get started with a brief update. What I want to offer to you is first that we're joined on the telephone town hall with the Commissioner Dana Smith. Dana leads the Department of Emergency Response. The Emergency Response Department, of course, is key to responding to any emergency. County governments are required to organize our emergency response structure, and the Commissioner leads that effort. And we are now on day, well, almost day 100, but in the high 60s when it comes to active response to COVID-19 and the coronavirus pandemic. Also joining us this evening again is Dr. Anil Waidian. Dr. Waidian is the Commissioner of the county's Health Department, our Department of Behavioral and Community Health. He is an infectious disease doctor and has been working with his leadership team, including the Deputy Commissioner, Kathy Tetmeyer, in responding to this pandemic. Tonight we're going to cover a few items that I want to get to. If you have a question, dial 0 on your phone, dial 0 on your phone. But let's start with several updates that we want to cover for you tonight. So 3 key updates that we're making this evening, and I'll get into a little more detail in a moment. Number 1, we are working with Mayor Rob Rollison and county legislators Randy Johnson and Barbara Jeter Jackson to expand access to testing. This is the diagnostic testing you're familiar with in the city of Poughkeepsie, in particular to target and support individuals who may not have access to a vehicle. I'll talk a little bit about that, and that'll be a partnership that we hope to expand with Mid-Hudson Regional Hospital, and then from that, our area pharmacies, and I'll talk in some detail about that tonight. Additionally, you likely know we have consistently focused on providing care for those in nursing home, assisted living facilities. We're going to talk tonight about expanding our initiative in partnership with those facilities by engaging in a wide-scale testing effort to ensure that those residents of those facilities, at least we know their status and can monitor their status more aggressively. And then lastly, for all of us, we know that we're in the midst of what has been a very long pause, as the governor suggests. Now, I'd offer you that many activities continue, although the business community and our economic community and certainly schools have been on pause for these last 2 months. And tonight we're going to talk a little bit about the county's work toward restarting Dutchess and the focus on reopening and reconstituting both government, community activities, business activities, and the overall county activity. And we'll talk a little bit more about that this evening. So let's go to the numbers first. If you're on our telephone town hall and you have a question, dial 0. Let's start with some of the dashboard and information that might be important and helpful to you. and cover a little bit of that information. Number one, for your benefit, the county has engaged with our partners at Nuvance, at Mid-Hudson Regional, at Pulse MD, and others, and we've administered over 13,000 tests, 13,600 tests conducted throughout Dutchess County, and that has produced the numbers that you can see on the dashboard. And going to the next slide, you'll see, in theory, the next slide you'll see. Let's confirm those numbers. First, 2,683 confirmed cases with nearly 600 identified recovered. Now keep in mind that these are individuals that meet the established protocols that we deem recovered. So nearly 600 recovered. We've sadly seen 36 confirmed COVID-19 deaths. They have remained stable for the last several days, which is promising news for all of us. Jumping then to some additional data points. This is one of the slides. This is some of the information that is really going to be key to how we reopen and begin to restart activity in Dutchess County. So we've monitored hospitalizations with area hospitals, all of our hospitals. We've monitored the severity of cases in those hospitals, and we've worked with Dutchess County's healthcare providers to monitor and of course report to you what those numbers are. First and foremost, 71 individuals currently in hospital care, and as a reference point, our area hospitals have an average capacity of just over 525 beds. When you start to look at the trend that we've seen over the course of the last month, the averages, you can start to see the decline that we need to see in order to, one, make sure that we're not overwhelming the healthcare system, and two, reopen, restart activity here in Dutchess County. Now, what is important with this decline, so really over the last several days, we've not only seen the numbers start to decline, stabilize, but we are seeing a bit of a decline in total hospitalizations. I think we have one more that we'll show for you just as a reference point that we think is useful. We have one more hospital slide? No, I thought we did. We'll go back to the daily. As you likely know, the goal of keeping people staying home was not only obviously to respond and slow the transmission, but by slowing the transmission and the severity of those cases, the goal was to not overwhelm the healthcare system. The steps that we've taken locally have produced an outcome, and that outcome has been a stabilization of hospitalizations and now the beginning of what we believe is a decline in total hospitalizations. That's promising news for us in general, but for the hospitals specifically, we've been working with them over the last several weeks. Last week, we worked directly with Dutchess County's hospitals in an effort to encourage New York State and the governor to allow our hospitals to begin conducting elective procedures, necessary procedures, but ones that were on hold during the pandemic. Today, Governor Cuomo agreed with that effort and announced that Dutchess County will be among those counties that can now proceed, hospitals can now proceed with necessary procedures, elective procedures, and we'll be working with the governor's office and the state to develop those specifics and roll out those guidelines. And that's promising news for all of us. So you have likely visited the county dashboard. If you visit dutchessny.gov, you can see our dashboard where you can get regular updated information, the data points. Many of you have asked, and I'll answer the question right now, why is there always a difference between Dutchess County's numbers and what you might see on the CDC, what you might see from Johns Hopkins, you might see at the state DOH, and some of you have said you may even see a different number on the Weather Channel app. I'm not sure. But the Weather Channel apparently has been tracking these data points as well. On any given day, a number of providers input test information, positive confirmed case information, death information into the New York State database. Throughout the course of the 24 hours that follow and beyond, health departments like ours are required to confirm those numbers, and that takes a lot of time and a lot of resources from county personnel to validate that particular information. So over the course of any day, we are updating that data in the county's dashboard, and we're providing it to you the following day. So our data points are, in essence, 24 hours after they're inputted in the state system, but a bit more granular and a bit more accurate, because we're spending the time to have to validate that information. Now, that is all part of what the state of New York requires counties to do. It's one of the reasons that we talk often about county governments being the front line of response. I think that's important that you understand that county governments in responding to this pandemic are on the front lines. And of course, our Department of Behavioral and Community Health has been leading that effort and trying to validate those numbers. So that's why you see a little bit of a change difference between what you might see on Google and what you might see on the county's very own website. If you have a question, dial 0 on the phone line. We'll try to get to you. It's probably a good point to reference the fact that we've been blessed with a number of people working as volunteers in volunteer capacity all across Dutchess County. I want to acknowledge our friends at the Medical Reserve Corps, led by Joe Ryan here in county government. Since the onset of the pandemic, over 200 individuals have joined the Medical Reserve Corps. We're now at 700 active volunteers. And those volunteers throughout the course of these last several months have logged over 3,300 volunteer hours in this year, compared to, by the way, 4,000 hours all of last year. So just as a reference, these individuals have staffed more than 230 shifts at the coronavirus call center here in the county, logging over 1,000 hours of volunteer support. Many have been volunteering to deliver groceries and medication to residents throughout our county. Dutchess responds, averages 11 inquiries for food daily, and makes an average of 21 deliveries per day. Additionally, more than 340 households have received deliveries through Dutchess Responds. So they're doing an enormous amount of work, and we're very, very grateful to the volunteers. It's also important to tell you that county government has been functioning. If you visit our Facebook page today, you'll see contact information for all of the county departments. We're running certainly with in a new model, right? Many of our employees are working from home, certainly scaled down significantly, but in the same respect, county government's functioning, and we have obviously remained active and responsive to you. So if you have a question on the line, dial 0. If you want to follow up with and are looking for additional information, you can visit dutchessny.gov, or call the coronavirus hotline at 845-486-3555. Let's start with an update and a new initiative to address testing, in particular access in the city of Poughkeepsie. So working with Mayor Rob Rollison, county legislators Randy Johnson and Barbara Jeter Jackson, we are happy to tell you that we are expanding access to test sites near the city of Poughkeepsie by developing a pickup and drop-off program. This is first in partnership with Mid-Hudson Regional Hospital, working with the city to expand access to that site. Residents who don't have access to a vehicle or can't drive up and through one of the existing test sites. We're grateful to Nuvance, Pulse MD, and Mid-Hudson Regional for making these test sites available. We will have an opportunity, and you'll see the phone number provided to you later this week or by Monday of next week. You'll make a phone call in to the city of Poughkeepsie. The city of Poughkeepsie will advise you as to the steps that you need to take in order to register for a test with Mid-Hudson Regional, and then we'll schedule with Mid-Hudson Regional a pickup for you. So Dutchess County will have a van or bus come to pick you up, drive you to that particular testing at Mid-Hudson Regional for set appointments. These are all set appointments, and again, these are for individuals who don't have access to a vehicle, and that will begin as early as next week. We want to thank those in Mid-Hudson Regional, Mayor Rollison, the legislators, Randy Johnson and Barbara Jeter Jackson, for being of some assistance in making sure this happens, and to Mayor Rollison and the team of folks in the city of Poughkeepsie very, very grateful for the work that they're going to do to coordinate picking up and dropping off, scheduling so that we can pick up and drop off individuals at the test site. So again, this is a pickup program. We'll schedule through the city of Poughkeepsie. You'll get an appointment with Mid-Hudson Regional, and we will have a van pick you up, drive you to the testing site at Mid-Hudson Regional, and get you back home again. This for individuals without access to a vehicle, in partnership with Mid-Hudson Regional and Mayor Rollison and the city of Poughkeepsie. You likely also know that Governor Cuomo announced last week or over the weekend that there's an effort to expand testing access at local pharmacies. He's provided pharmacists the authority to offer tests. The issue at the moment is that there isn't access to those tests yet. However, immediately this week, Kyle Ketchum from our offices began coordinating with area pharmacists. I want to thank Nasser Mahmood from Pine Plains and Bill Irwin, who have been working with Kyle and the Department of Behavioral and Community Health. We expect that as test kits become available, that pharmacies locally will be prioritized, and in particular in areas that don't have easy access to the test sites. So we envision Eastern Dutchess, the city centers, Northern Dutchess, being locations that pose a priority for us. There's a planning meeting tomorrow that Nasser, Bill, and Kyle will be coordinating, and hopefully within the next several days, in concert with the governor's order, and when test kits become available, we'll be in a position to begin pharmacy walk-up, drive-up testing. So again, new testing access through our Poughkeepsie pickup and drop-off program. We'll be providing transportation to the test site, and we're working to expand pharmacy access. Secondly, tonight, and I know that several of you have questions, we're going to get to them, I promise. I want to also provide an update on work that we're doing to protect individuals living in nursing homes here in Dutchess County. So our Department of Behavioral and Community Health has been working diligently over the last several weeks to coordinate with our nursing homes. We've been working to provide them guidance, access to personal protection equipment, and we're in regular conversations. So we're aware of the status of individuals in those assisted living nursing home facilities. We keep track of and communicate with those institutions, those organizations, and the status of their patients, those residents, and we've been providing what assistance we can, and they have been communicating regularly with us. I do want to thank them. This is a very tremendously difficult time for families that can't access their loved one, can't go visit their loved one. We know, believe me, I know this better than most personally, to see somebody in a struggle and not be able to be there with them. That's a challenge in and of itself. The staff and the administration at these facilities are doing the best that they can, and they're doing some wonderful and amazing work. At the same time, there's a need to be sure that every individual in every nursing home is safe and healthy. So we established several weeks ago our nursing home task force. It's led by Mario Gonzalez and Ann Saylor, along with Kathy Tetmeyer. They function as the liaisons to the nursing homes on this task force. They engage in regular communication and weekly conference calls to identify the status and work toward addressing concerns within those facilities. We've had success so far. We know that identified there are a limited confirmed number of positive cases in nursing homes throughout Dutchess County to date. Sadly, there have been several deaths, but we have worked tirelessly to limit those and to provide and ensure that people have access to the care that they need, and that we're monitoring their status. And that working relationship that we've had has provided for us a great opportunity to coordinate, even though Dutchess County doesn't have regulatory authority. New York State regulates nursing homes. Dutchess County does not, but that relationship that we've developed has been very, very helpful. And so yesterday, you likely know that Ulster County announced after testing at nursing homes in their community, information that is distressing, that we, Ulster and Dutchess, have agreed to react and respond to aggressively to get ahead of any concern. But 96 out of 330 residents living in 2 Ulster County nursing home facilities tested positive. This was somewhat concerning because individuals at these nursing homes, 96 of them, many of them, did not show any symptoms, and that, of course, is a bit distressing and really compels the need to act as quickly as possible so that we are proactively ahead of any concern. And so, working with Ulster County, we've made a request to the state of New York. We've asked Governor Cuomo to make available test kits to Ulster and Dutchess to immediately begin an effort to aggressively test at every nursing home location in Dutchess County. I'm confident and grateful that it is being addressed. The governor's office has advised they're working on it. We expect that shortly we'll have the ability to proceed with support from the state of New York. Grateful for that. In the meantime, Dutchess County does have access to a small amount of test kits. So to be proactive, we're going to proceed with testing every individual living in a nursing home facility in the county. We have and are in the process of securing the personal protection equipment necessary to ensure that as we test, that those staff at nursing homes have the PPE necessary, and that we're working with their staff, their infectious disease specialists, to ensure that in every case, we already do have a plan, but if we identify individuals more so than we already know have tested positive, we want to be sure that we can respond in each particular location. Now, those facilities are responsible for that planning, but we're going to continue to support them, and we are going to begin with a pilot effort at Wingate at Beacon. This is where we'll begin. Dutchess County's Department of Behavioral and Community Health will work with Wingate at Beacon. We do need them to agree to let us in and to do the testing, so that's one of the efforts. In this case, Wingate has agreed, and we're going to initiate that shortly. So as we work with the governor's office to access additional tests, we're going to expand to ensure that every individual living in a nursing home facility in Dutchess is tested. And then as we can access rapid testing, our goal is to make sure that there's an ongoing monitoring. And again, we don't regulate this, but through the relationship we have, we're going to initiate it, we're going to work with them, and we're very confident that the state is working to support our efforts to do that, Ulster and Dutchess combined. Additionally, we are deploying the Dutchess County Trauma Team to provide support to nursing home staff. This is important. Dr. Ellen Marks, who's actually been on our calls before, she leads this team. The collaborative team of mental health and substance abuse professionals are available to respond to incidents and concern throughout. And we recognize that during these last few weeks and going forward, there is a heightened degree of stress, concern, and fear among employees and individuals living at these facilities. And because of that stress, the team is going to work aggressively now to provide in-service training and support to staff to address a range of emotions, working through related stress issues, dealing with grief, the importance of self-care, and other priorities. So again, we're going to deploy an aggressive testing regimen. We're going to work to ensure every individual in a nursing home is tested. We're going to begin that immediately. We're working with the state to access appropriate tests, and I'm confident that that's being addressed so we can make sure this happens county-wide. And we're deploying the county's trauma team to provide mental health support to staff and those living at facilities. So why don't we do, let's take a question or two. Are we prepared, Chris, for a question? I know that Don from East Fishkill had a question regarding when are we going to get, or Dan from East Fishkill, I apologize. Dan, if you're on the line, go ahead and ask a question. Dan, are you with us?
Yes.
Oh, go ahead. What's your question? Thanks for joining us.
I watch the news every day, and I see the numbers in Dutchess seem like they're going up as far as the coronavirus goes. That's not a good thing. I know you said a couple weeks ago that we're a week or so behind. My two concerns are, do you think it'll be, what numbers do we have to get at until we can actually go back to having schools open and deals we can work at and play at and go to games, all that? Is there a particular number you're looking at?
Yeah, it's a good question. The short answer is you're going to see confirmed positive cases. The rate of growth is slowing, but as we test, we're always going to find individuals who test positive. The real key is the rate of growth slowing, are the recoveries advancing, and are hospitalizations decreasing? And the good news for us is that, the short answer to that is we're in a plateau stage now we are likely seeing some decline and certainly decline in hospitalizations. The decline in hospitalizations is the real key. So as we test regularly and there's more access to testing and hospitalizations decline, we begin to restore and return to normal. So you packaged a couple questions in there that are really worth answering. You're going to see, and we're going to talk a little bit about restarting the economy. We're going to push as responsibly, as aggressively as we can to get those kinds of business activities that can function in an environment where people are protecting themselves, masks, gloves, sort of the basics. If we can, we think that we can push open certain activities sooner rather than later. But you mentioned I think you said sports activities or school. The governor is going to make a decision on schools this week. I will tell you right up front that we do not think that it is logical or logistically necessary at this point. It's not logical to see schools reopen in full-fledged for the remainder of this year, because we know that in this region, in particular, the fact is that the transmission could be great. We worry that having kids go back to school, they become a vector for the disease, come back home, and all of a sudden we have a spike. The governor will make that decision. We're hopeful he's considerate. We know he'll be considerate of the concern that we have locally. We don't think it is logical to have that occur. I said that last week for the duration of this year, but we'll work with the state on that. As far as activities this summer, it is clearly going to be very limited. I am doubtful that you're going to see large sporting events or like travel sports occurring this summer. Now that doesn't mean there wouldn't be other activities. Maybe localized intramural sports, no major audiences. Those kinds of things you can envision happening later in the summer, but group settings likely not to happen. But I'm telling you, we're going to talk tonight about restarting Dutchess. We are going to push as aggressively as possible to start to open up certain activities as soon as possible. I believe you're going to see some of that happen over the course of the next week. You're already seeing in hospitals, and by May 15th, you're going to see an incremental reopening of certain activities. So thanks for that. Hey, Dr. Wydian, while I have you on the line, did I describe the indicators that we want to monitor appropriately? And it's likely that we're going to see positive cases, but so long as we see recoveries expand and hospitalizations stabilize and level off, those are the promising data points we want to hear. Correct?
Mark, you're correct. I think it's unrealistic to think that there will be no disease or transmission activity in the community. The important thing is we want to be able to be at a situation where our healthcare systems are not overwhelmed and we are buying time in terms of our activities for an effective vaccine and other treatments.
Okay, I appreciate that. And again, those asking about schools, we don't think it is logical to send students back to school in mass, in groups, sort of large setting. Could there be some activities that occur, perhaps limited? We don't want we want graduates to lose out on that experience, although what a graduation looks like this year is likely not to be what we experienced. It'll be memorable, but not what we've experienced in the past. And we want to create those opportunities, but we don't see that it is logical. But again, the governor will start to make that decision this week. We've informed them of our opinion, and as he comes to a conclusion with his decision making, we'll have some additional updates. For those of you who are watching, first of all, if you have a question, comment below. If you're on the call, dial 0. Let's talk a little bit about reopening activities, and whether it's unpausing New York or reopening. Or what we're referring to as restarting Dutchess. I want to talk a little bit about getting things up and going again, and what we're focused on. So this is an update for you. This is some new information I'd like to share this evening. So as you know, the governor instituted the New York pause. We're familiar with that. It is scheduled to be in effect until May 15th. Originally, the governor's view was sort of a total statewide reopening. We encouraged and they embraced this regional concept, the regional reopening. Likely that originally Dutchess, Ulster, and Orange were sort of lumped together in the Hudson Valley Economic Region, which included Westchester and Rockland. we have, I believe, successfully petitioned for some latitude and consideration separate and apart from Westchester and Rockland, and you've heard it in the governor's language. He sort of says Westchester, Rockland, and then Westchester, Rockland South, and then everything else is upstate. That I don't think is going to be exactly how it occurs. I do believe, and you're already seeing it over the course of the next several days, you're going to start to see a restarting of activity. Hospitals being first, you saw that. I think that that's going to happen progressively over the course of the next several weeks. And as we get to May 15th, you're going to see a little bit more. I do believe that Dutchess, Ulster, and Orange will be considered moderately separate from Westchester and Rockland. We have been working collectively, the three counties, to restart, or we've been working together to respond, and now we're collaborating on a plan to phase reopening. Now, it should be clear that even though the pause, if you will, is going to be lifted to some degree on around May 15th, we're not truly going back to pre-March anytime soon. The truth of the matter is we are going to live in some sort of heightened awareness environment for some time to come. And so what we've done is really forced ourselves to think differently about how we provide services. So within county government, not just employees going back to work to do what we've done, but staffing levels will be different, workspaces need to be accommodated. And you've heard these things, right? Limited physical interaction, capacity, distancing. You know all of these things. And now county government has been engaged in sort of reevaluating how we're going to provide services moving forward, with a focus on ensuring the health and safety of our employees and the health and safety of you, the people we serve. So we launched some time ago our work group to address county governments reconstituting. We've asked for every department to develop a plan within certain parameters with the expectation that, again, we're going to have to take into consideration certain populations aren't going to come back to work immediately, vulnerable, those with underlying illnesses. We're going to have to be sure that we're protecting employees' health and the public's health. That'll be part of the reopening and the restarting of Dutchess. We've developed 4 teams throughout Dutchess County to focus on restarting Dutchess County. The first is focused on county government functions. This will be led by the Deputy County Executive, Bill O'Neill, along with County Clerk Brad Kendall and County Legislator John Metzger. So those 3 are leading this team to focus on county government functioning and restarting the functions of county government. The second is our fiscal and financial team. This is a focus, obviously, on the financial impact of county government. That's going to be led by our Budget Director, Jess White, along with County Comptroller Robin Lois, and County Legislator Will Truitt, who chairs the Budget and Finance Committee in the county legislature. The third is really focused on the broad opening of businesses, and we've been at this for months, just so you know. That effort, led by Assistant County Executive Ron Hicks and the Think Dutchess Alliance, has been working over these last months to develop protocols and really pushing the state responsibly on what segments of the economy can open up quicker. And we're ready. We're ready to start moving. We've asked for some advancement on manufacturing. We think there are certain businesses that can be functioning soon, and we believe that that is appropriate and that we can meet the health and safety protocols to do that. So the Economic Development Small Business Team is led by Assistant County Executive Ron Hicks, the Think Dutchess Alliance, and County Legislator Don Sagliano. And they're focused on getting our economy and small businesses opened, and will continue to advocate with the state. Now we're going to think big, we're thinking differently, we're going to be bold about this, but we're also going to be very sensitive and really provide direction to business owners all across Dutchess on the steps that you should take to stay safe, but to get back to work. And so restarting Dutchess is a multifaceted focus. We have our 4th team working directly with local governments, towns, villages, and cities. That effort I'm going to continue to lead. I meet with the town supervisors, village and city mayors every Monday and Thursday. We're working towards reconstituting local government. I'm going to be joined on that effort by Legislator Randy Johnson, who's going to help us lead that effort, along with County Legislator Deirdre Houston. And so twice a week, mayors and supervisors all in a focus to restart local government and local economies. We're going to focus, in fact, next week almost immediately on coming up with some ideas for village and city centers, sort of indoor-outdoor centers of business where we could create some relief. So as we open, it'll be easier, in particular for restaurants and retail, to function under these new environments. Those are the teams that are working. What I'd like to do is get to Claudette. Claudette is on the line. If you have a question, dial 0. We'll take your question. Claudette, if you're on the line, go right ahead.
Yeah, well, my question was that we're in our 70s. I just turned 70, and I want to know how safe it is to go to the supermarket and walk in the neighborhood. A lot of people I see walk without a mask, and I was wondering how safe that is. Thank you.
Dr. Wyden, would you like to answer Claudette? I'll start by saying happy birthday if you just turned 70. Thank you for that. And Anil, would you like to talk about what should Claudette and her husband be aware of when they're out in public, and what should they be concerned about when they get to a grocery store?
I think the guidance that's out there in terms of social distancing is very important. We know that, again, with this pandemic, it is the face-to-face and social interaction that is the opportunity for transmission to occur. So, again, it's also quite tough for individuals to be sort of staying at home. So I think it's important that, again, if you have the opportunity to go out, walk, and still maintain social distancing, these activities should not be something that you should be afraid of, but should partake in. Now, with regard to going to grocery stores, it may be a little bit more tricky, and you should try to find, hopefully family members who could do that activity for you. If you must, try to go at a time where maybe there is not a lot of people that are there. But the important thing, if you are going to do that, other than social distancing and hand hygiene, it's also wearing a mask in public. It's also important to take into consideration.
So we want you to be safe. We want you to get outside if you can. Certainly, if you're walking your driveway in the end of your road, you should. I think the direction is basically have a mask with you. If you clearly aren't going to be able to engage in that 6-foot social distancing outside of your husband, then you should wear that mask. And certainly if you're heading to a grocery store, many of our grocery stores have special times for seniors. It's not always I'll be candid with you, it's not always the best because a lot of people take advantage of those special times. But you might get to a grocery store and determine that it looks empty. Make sure you have a mask on, head on in, follow those precautions, be somewhat distant, physically distant to those around you. And so that is safe. Nothing is foolproof, but a mask or face covering, and social distancing is what would be helpful for you. Getting a lot of questions on the Facebook live stream about unemployment insurance. I was told on a call earlier today that I was being far too polite, even though I thought I wasn't. The unemployment system was outdated when the state had it years ago. It is overwhelmed without question with the number of people who rightfully want to access that insurance. Dutchess County did suggest, we did this through our economic development team, that New York State immediately, from day one, not have a follow-up phone call response. In fact, we said abandon it. Let residents and those in need file online, go through that process online, and access that support online. The state still requires a phone call back to you. The system has been updated, but I'd argue not improved. This is not a question of whether or not the people on the other end of the phone aren't helpful. They certainly want to be. But the system is overwhelmed, it is not responsive, and there are a lot of people trying to access. The only thing I can offer to you is that the state operates the system. We're going to continue to advocate to make it easier. You should, to the degree you can, be patient, but you need to stay vigilant in reacting and responding, meaning keep emailing, keep phone calling, keep submitting. And we're going to keep advocating that they make it easier and quicker. That said, remember, once you're finally through, and we do know a good number of people have made it through the system and are getting their unemployment benefits, those benefits are to date back to the time of unemployment. So regardless of when you finally get approved, you are to get reimbursed, you are to get paid back to those dates. That may not be enough, and it may not be a total benefit, and I'm sorry that the system is so sluggish, but I will tell you it was a 1980s model years ago, and we're still, the state is still trying to aggressively deal with it. The governor said he's taking responsibility for it, but at the end of the day, the system is not as responsive as it needs to be. We're going to keep working with them. I promise you we're advocating for fixes, and from our perspective, we'll do everything we can to advocate for our residents, but the state system is overwhelmed. The same is basically true with the Small Business Administration Loan Program and the Paycheck Protection Program for small businesses. Overwhelmed, and this is one of those moments where I will take liberty and tell you that local governments are generally the most efficient. We just have the capacity to respond to you more effectively, and gosh, it would be nice if the state and federal government had the capacity to partner a little bit more directly with us so that we could be of more help to you with those programs. But I promise you we're continuing to advocate for you. We're going to go to a phone call from Barbara. Barbara, you had a question regarding testing, and I know others are asking about testing. Please feel free to dial 0 on your phone to ask a question. Barbara, go right ahead. Barbara, did you have a question? Barbara, if you're not there, Barbara's asking about testing and access to testing. The diagnostic testing underway. Dutchess has tested about 4.5, nearly 4.8% of our total population. Dr. Wiley, why have you? Do you want to talk a little bit about the expansion in access to testing? And maybe while you do that, explain the difference between the current diagnostic testing, the rapid test, and the antibody testing. I think the public would like to know more about that.
Thank you, Mark. There are two approaches to testing. One is to look for the presence of the genetic material in the secretions in the upper airway, and that requires a swab, and the swab is sent to a lab, and the lab tests that swab for the presence of genetic material, and the results of the test indicates whether the presence of the virus is there or not, and that is typically the diagnostic test. Another test that's available is what's called a serologic test. This test for the presence of something called IgM and IgG, and these are particular antibodies that your body makes as a result of its fight against a particular pathogen or virus or bacteria. The presence of IgM and IgG indicates you had an exposure or an infection with an agent and that your body has or is recovering. Now, rapid tests can be both the diagnostic as well as the serological test. Unfortunately, with regard to the serological test, most of the rapid tests that are out there have not been validated and really tested and honed and approved by the FDA. So even though there's been a grand expansion in the availability of testing, we still, in terms of validation, are still waiting for that to be done with the serological testing.
And so the question regarding access, I think we talked a little bit about already, but I'll repeat just for reference. So number one, currently we have our public testing, the drive-up test sites. Talked a little bit about the initiatives that we're expanding today, but our drive-up test sites at the Mid-Hudson Regional Hospital, at Dutchess Stadium in partnership with Nuvance, and Pulse MD in the town of Poughkeepsie. Other providers there are other providers who can provide tests, but they're between a patient and a physician. Is that correct, Anil?
That's correct.
And so,
and Mark,
go ahead. Yeah.
And Mark, you mentioned what's coming ahead with regard to pharmacies, and that should be in terms of access would be a game changer for the community.
Okay, and that's the goal: greater access to So the hope is our team that we've organized with pharmacies, Bill Irwin, Nasser Mahmood, Kyle Ketchum, will work toward making sure there's access at pharmacies once those test kits become available. We're working for broader access through our pickup and drop-off program in the city of Poughkeepsie. And then those rapid tests will be more broadly accessible among institutions, providers, etc. Dr. Wyden, while I have you, you're with us till 7, like it or not. When we say someone's recovered on our dashboard, Veronica from on the Facebook page has asked, what does recovered mean? And I think that's a good question because, in truth, I mean, recovered is a bit of a gray data point, isn't it?
That is correct. You know, recovery by our ethic definition means if someone was identified as being symptomatic or with a positive test, have they gone past the confinement date of self-isolation or their symptoms have improved? If they meet those criteria, they technically are recovered. But that does not mean they're totally free from symptoms, or we don't know whether they've been hospitalized since that time, because some people can get worse after that period of confinement has been over.
So I mean, recovered means that they've exceeded the basic expectation that they stay home, they quarantine, and symptoms subside, but it doesn't truly...
That is correct, Matt.
Say again?
That is correct, Mark.
So to that point, a lot of people ask, can I catch it again? What do we know of that?
I will tell you that there are case reports out there that individuals who have tested positive have tested positive subsequently, but the literature out there in terms of whether you could get sick from the virus multiple times is lacking. So I could not give definitive answer in terms of whether someone can get sick multiple times. But if people develop immunity, the likelihood of that is extremely low.
So another question that comes up while we're going down this path is if one has contracted COVID and in theory recovered, does everyone who's contracted it build up some immunity to it?
Not necessarily. Oftentimes, I will tell you there are disease states and viral pathogens that we give vaccines for. Sometimes we follow their titer. Sometimes the titer drops, and in those instances, we may give them a booster of the vaccine. So just because someone may have recovered from an illness does not give them absolutely that. Again, we could say for certain that they have full immunity.
Fair enough. Let's jump to a different topic. We have a question from Gina. Gina lives in LaGrange. Gina was talking and had a question about summer camps and flea markets, etc. Gina, do you want to ask your question? And if you have a question, dial 0 on your phone or offer a comment on the live stream. Go ahead, Gina. Gina.
Yes, I was just wondering about summer camps this year for the kids, and also how the governor calls it attraction nuisance, or how he puts it, is the flea markets, because it's going to attract a lot of people. So I was wondering, what are you going to do about that? Are you going to close those down, or are they going to be open?
Good question. Part of what we do in Dutchess will be whatever within the guidance that the state gives. Remember, in theory, the governor does trump us when it comes to making certain restrictions. So number one, our health department does permit, we're responsible for issuing permits to summer camps. As of today, we are not approving those permits, but we are asking people that host those camps to apply. When they apply, I know you can say I'm wrong, but when they apply, we're asking them to consider the fact that there still will be need to address social or physical distancing, slowing transmission, personal hygiene, face covering. So if you're in a camp setting, tell us how you would accomplish protecting people from transmitting the disease. And by supplying us that information, as the restrictions ease up, we can determine if you're ready to perhaps have that permit issued. But I will tell you, and Anil, again, I'm going to stop and ask you to kind of offer some guidance as well. Our position is that large gatherings certainly during the early part of the summer, would be very, very troubling and problematic. So we would want to limit that. Now, as it relates to yard sales, the governor calls them an attractive nuisance. I'm a parent. I have young kids. At sometimes, and like during this experience, we had to finally close playgrounds. Playgrounds can be an attractive nuisance, right? Because telling my kid he can't go on the swing is going to be very difficult if he sees it, right? So the same is true for this kind of a destination, a yard sale, a flea market. However, like, for instance, farmers markets, there are protocols you can put in place, and we've seen these all across the country, to limit the number of people who access at any time, and that you're engaging in social distancing and protection. Again, if the state eases up on restrictions and these organizations can meet some of those protocols, we can consider them, but I'll offer you that those kinds of things are going to be very problematic. Anil, do you want to add to that?
Mark, I think you encapsulated the issues really well. We are open to creative solutions, especially as it relates to activities as the state sort of eases some of the restrictions. But we want, facilities and programs to give us clear, scenarios in terms of how they will be protecting not only their staff members, but people who access their resources and their programs.
And we offer that during the summer months, at least certainly during the early part of the summer, if those things can't be addressed or there's an unwillingness to address them, and it's unlikely we would permit them. If you can address them and you want to work towards a goal of making sure that we're protecting individuals and their health, because again, the goal is just to make sure we don't exacerbate the transmission of the disease. If you can do those things, we can consider permitting them and moving forward with that. So that, I think, is the guidance we give as of this moment. I think that's helpful. We had a question on Facebook regarding. I'm sorry. I wanted to add to that. For instance, farmers markets are considered essential because they do provide support to agriculture, and this is a moment where if you do have resources, and I know people are struggling financially, but if you have a few dollars and the choice is to go off to a national chain, or you could afford to head off to your local farm market or local grocer, we'd encourage you to make that purchase there. But farmers markets can open. I believe Rhinebeck's farmers market may be opening as soon as this weekend. They've established protocols that we've embraced. We agree that they're the precautions necessary, where the social distancing, limited number of people in a closed setting, and we'll be able to monitor. That's the kind of thing that those kind of locations, those attractive nuisances, if they were to engage in that kind of protection, then we'd want to see them proceed in a responsible way. We were asked folks who may be in need of food or transportation. Again, if you visit dutchessny.gov, you'll see a button called Dutchess Responds, a tab called Dutchess Responds on the website. You can visit that to both provide, if you have resources you want to donate to our efforts. We've purchased thousands upon thousands of meals. We're supporting, thanks to the community foundations of the Hudson Valley, who's hosting our fund. We're supporting pantries and organizations across Dutchess County. So if you have a particular need, visit dutchessny.gov, Dutchess Responds, or you can dial 845-486-3555. 845-486-3555 is our COVID hotline. I do want to mention that hotline is going to remain up and running for the foreseeable future. We're going to evolve the hotline. In fact, we're asking the legislature for $1.5 million, I think, $1.5 million for purchase of protection equipment. And I'm going to get to that in a moment. And also expanding and continuing support for the hotline and other communication tools to be available to residents. So, for instance, the hotline originally was focused purely on responding to COVID. We're now evolving to respond to some of the economic questions and the unemployment questions. So those things will all be a part of how we manage and evolve the hotline. So 845-486-3555. Camille, I think, has a question regarding masks, disposing them, using them, etc. Camille, do you have a question?
Yes.
Go ahead.
Hi. I just didn't know if I'm not even sure which kinds of masks I should be using, and whether out in a place where there are a lot of people, I know everybody is wearing masks, if I should dispose of them after each public event.
That's a good question. So number one, we want to tell people, if you're just going out socially, you're going to the grocery, I don't mean socializing, but going to the grocery store, or you're heading to the rail trail, or you're walking down the sidewalk, remember, it is expected that you have a face covering on you. And we use the term face covering because in that kind of setting, a scarf, a homemade mask, handkerchief, although my wife tells me it's kind of funny to tell people to, you know, to put on, to take out your handkerchief as if we're all, you know, just sitting home with bandanas lying around. But nevertheless, you could take a pillow cover, a t-shirt, and create your own covering. In that kind of setting, that works. But Dana Smith, while you're on the call, you're our Chief Personal Protection Equipment Procurement Officer, the Commissioner of the Department of Emergency Response. He's been working tirelessly for weeks now, buying and distributing goods. First, why don't you tell us basically what have you been doing? And then secondly, what's the difference between the masks and what's the protocol if I'm using a homemade mask versus using a medical mask? As far as disposing them and using them. Go ahead.
Yes, certainly. Here at the Department of Emergency Response, our role in emergency management is to support county entities, local governments, and response entities, and in this case, the hospitals, nursing homes, assisted living facilities, and a bunch of other organizations that are on the front line in assisting them in securing PPE. For the past almost 2 months now, myself and our staff have been securing PPE from a variety of sources, including overseas. County Executive Molinaro has supported us and allowed us to use county funding to secure the necessary PPE. We're not meeting every need 100%, but we are continually providing PPE in smaller amounts to all these different entities. No one is going uncovered, though, from what we know. Regarding masks, a face covering is reusable, and traditional medical masks are not recommended unless you have some underlying condition or you're dealing directly with a suspected or positive COVID patient. Face coverings, again, are reusable. They become soiled, torn, or dirty. They can be re-washed or laundered. Medical masks traditionally were always single use. However, due to the shortages and stuff, the CDC and the State Health Department made recommendations for extended use up to the day, and in some cases even longer. And again, with those masks, it has to do with that they become soiled, saturated through perspiration or expiration, or if they become torn. As far as disposal goes, a face covering or a mask that's not directly involved with a pathogen or a COVID patient, those can be disposed of in household trash. They should not be left in your grocery cart or on the ground in a parking lot, because that just creates another problem for someone else to deal with.
Now let's be real. Just throwing them out on the sidewalk or in the parking lot, we've seen medical masks, we've seen gloves. As my 3-year-old son Eli would say, "Come on, man. We can do better than that," and we've really encouraged people. We're living in a very different time at the moment. If you have a reusable cloth mask, this one happens to be mine and my favorite. This was given to me by Unshattered, but this is hand washed. I hand wash it every day with a little bit of soap and water, let it dry, and then reuse it. Is that safe, Dana and Nil? Did I do that right?
Absolutely.
and then so the traditional medical mask or an N95 medical mask should be reserved for responders and folks in medical service. For you and I, if we're out in public, you can get your hands on one of these. A lot of organizations just making them, sewing them. If you go on dutchessny.gov or visit us on our Facebook page, you can see a tutorial on how to actually make one out of a handkerchief or a piece of cloth. But if you're going to wear those masks, make sure you wear these kind of masks. Make sure you do hand wash them, clean them, dry them, and not use them over and over again. And for the love of all of us, please don't throw them out on the sidewalk or out the street. It's a good moment for me to remind people we are still in this sort of restrictive environment. We get it. The goal of this was to limit the transmission of the disease so that we could slow the impact of hospitals. If that is in fact the case, meaning that was the goal, we are doing it. Dutchess County is achieving that goal. We have stabilized hospitalizations. We are seeing a modest decline. We believe that we can see daybreak, that we are moving very aggressively now toward restarting Dutchess. But in the meantime, please, in particular, social gatherings, large groups is just not appropriate. It just isn't. So whether you're living in the city of Poughkeepsie and, as the mayor knows, someone thinks they can throw a party, or you're just congregating out on the rail trail, it's just not the time to do that. Please keep it small, keep it local. If we keep it in-house and just a little bit longer. In the meantime, we are pushing aggressively up to Albany efforts to restart the economy, restart businesses, and reopen community and government. Nate and many other people are asking about church. This is what I would say. I mean, I'm a churchgoer. Pastor Frank Cerrone has missed me, or I've missed him. But I would offer to you that right now, up until May 15th, certainly there's no sort of reopening of those social environments. Now, people should pray. If you pray, you should be encouraged to do that. We see a lot of churches, synagogues, mosques celebrating Holy Week, Holy Period now. We're doing it online, virtually. We suspect that the church, we want the church community, we want faith communities to be able to engage in that prayer and congregation together soon. There are going to have to be protocols in place to limit capacity, to engage in the physical distancing, and certainly those who are vulnerable will need to probably continue to keep distant for the foreseeable future. That is not going to be in the next 2 weeks. So I would not expect social events, large gatherings immediately, but we do, believe me, understand not only the constitutional right, but also the emotional and personal and spiritual value of that time. And so to the extent that that can move forward in a responsible way, we want it to happen. In the meantime, continue to engage in that virtual interaction. And, we're all taught, all of our faiths teach us to treat others the way we would be treated, to love your neighbor. This time of physical distancing, this time of limiting that social interaction is, and I say this respectfully, and I believe this I'm a Christian, but I believe this as a Christian, it's my exercise of my faith by trying to ensure that I don't transmit the disease, get someone sick, is my way of extending what I've been instructed to do in my faith, and I know that every faith believes that. So from our perspective, just a little bit longer, and I promise you, we want you to be able to get back to congregating together with certain precautions in place. Joseph from Beekman had a question regarding antibody testing. So there are a number of questions regarding antibody testing. Joe or Joseph, would you like to ask your question?
Hello?
Yes, go ahead.
Yes. Thank you for taking my question. I was wondering, is that going to be required in Dutchess County that people take antibody testing, and how would that work? Would you need a script from a doctor?
Good question. So currently, antibody testing is available in certain locations. Anil Wythian, do you want to, Dr. Wythian is the Commissioner of Behavioral and Community Health. Instead of me playing a doctor on TV, why don't Anil? You want to answer that question? One, remind us the value of antibody testing, and two, what are the protocols, and when do we think that there'll be broader access? Now, we are not going to require it, per se, but we want it accessible. You want to explain that?
Sure. Antibody testing is checking for the presence of something called IgG or IgM. These are antibodies that your body makes when it fights an infection. And serological testing that is available now, you could get through a physician, and a lot of the commercial labs are able to do that through a blood draw. Now, in terms of rapid antibody testing, there are many test kits that are out there validated. So again, it's taking a little time in terms of making not only the availability of quick or rapid antibody testing available, but also ones that are accurate and consistent.
And so we wouldn't expect that the government would require you to take the test, but we want broad access so that we can monitor both those who have contracted the disease currently and those who may have recovered from, or in quotes, recovered from it. That sound about right?
That's correct. If we have an accurate test, and that test is indicative of someone's immunity, then it would be very helpful to utilize that to sort of, especially in terms of getting back to normalcy.
Terrific, thank you. Genevieve asked a question on the Facebook live feed. If you have a question, write your comment in the comment block, if you will, on the live feed. If you have a question for the phone call, dial 0. We'll get you in. We're going to do this until 7, although I tend to push up right up at that limit. So please feel free to ask your question. Genevieve asked about hiring contact tracers and training and that process. So we do know that in order to sort of monitor prospectively, right, in the future, to monitor what where we are, so that we can maintain that decline in hospitalizations and slow the spread of the disease. Again, this isn't an enemy that we're going to necessarily entirely defeat. We're going to diminish its capacity to hurt more people. The goal here is to slow the transmission, not overwhelm the healthcare system, while medical professionals and those in the field can create a vaccine, a therapy, a treatment that would allow us to go about ordinary life again. So in order to be sure that we're not, when we restart things, that we're not causing a spike, if you will, access to testing is important, and also what we refer to as sort of contact tracing, right? This belief, this understanding that if you test positive, we want to identify with you, again, this is not intrusive, but identify those who may have come into contact with you and provide them the protocol to ensure that they protect themselves. This philosophy that you generally want to sort of contain and protect the sick so that the healthy can continue to go out around their business and conduct their business, and that's going to be critical in restarting things. So number one, we have 10 teams. Anil, how many teams of people are doing contract tracing? Do you know off the top of your head? I'm putting them on the spot.
Currently, there are 8. There are currently 8, and we are trying to bring a couple more on board.
So the expectation is 10 teams with currently Medical Reserve Corps volunteers. So if you're out there and you want to volunteer in that capacity, visit us at dutchessny.gov. We're happy to have you join the Medical Reserve Corps. That would be critically important, very helpful. We're redirecting staff resources, so people within county government that have been doing other tasks will be focused on this. And we are evaluating technology and some technology tools that will allow us to really communicate with you. So if we identify a positive case, we can work through perhaps your cell phone or something. We wouldn't know your information, but be able to communicate with those that you may have some association with or contact with, that they should be aware that they might want to get tested as well. So sort of a suspenders and belt option. But we're going to use staff, we're going to use volunteers, and we're going to use technology to monitor. And again, this is not to be intrusive or overburdensome or overreaching. This is to ensure that we identify people who are sick, we provide them the care and the protection they need, and prevent the transmission of the disease. While we can, if you have a question, dial 0. We're going to go to Frank in Pauling. Frank in Pauling had a question. Frank, go ahead.
What did you ask?
Frank, are you with us? You didn't ask anything. Are you there, Frank? I hear you.
Yeah, hi, this is Frank from Pauling.
I gathered. Go right ahead.
So my question is, how are we doing at the county? I mean, how are our numbers? I haven't heard much about that unless I missed it. Are we good? Are we going up? Are we going down compared to other counties in the state? More of a curiosity question. Have we flattened the curve?
Yeah.
I haven't heard much about that. I was wondering if anyone could speak a little bit about that.
We sure can, and I remind you that if you will visit dutchessny.gov, dutchessny.gov, you'll see Data Dashboard. There's a button, a tab for Data Dashboard. You can get numbers countywide every day. You can get specific numbers for your municipality, like Pauling, every day. And we provide you some data points, including total confirmed cases, which is 2,683, total recovered, nearly 600, and sadly 36 deaths. We also show hospitalization numbers. We've provided 13,649 tests. That's online. You can see that information. And then hospitalization of the 528 total bed capacity that we have in Dutchess County, we have 71 hospitalized for COVID-19. So the short answer to your question is that we have stabilized. We're still seeing some growth in confirmed cases, but recoveries continue to advance and hospitalizations have stabilized. You know, I would say a week ago, I would say to you that we were in the midst of a plateau. I'm cautiously optimistic that we are in a declining period, that we're starting to see the results. We're starting to see the results of our work, a reduction in hospitalization, and because of that, we're going to start seeing the restarting of community, restarting of government, restarting of the economy. And we're going to push up against that in order to get things active as responsibly as possible, as quickly as possible. So our numbers are looking up. They're very promising. We can see daybreak. And if you want to see those numbers, visit dutchessny.gov for additional information. If you have a question, dial 0 or add your comment to the live stream. Happy to take any questions you may have. Why don't I just go up, let's pull up the 3 highlights for today that I just want to provide an update just as a reminder. We talked a little bit about it. We have an aggressive team of government officials, local officials, economic development leaders, business leaders throughout Dutchess County focused on restarting Dutchess. The governor has sort of said by May 15th you're going to see some restoration. We're pushing right up against that. We want to get going as quickly as is responsible and safe. So our Restarting Dutchess effort is focused on that. Teams focused on reconstituting county government, restarting local government, the small business, supporting the small business community, and there's a series of teams working on that, along with our financial and fiscal analysis team focused on responding to county government finance issues. Also want to remind you that we're expanding our access to testing. In the city of Poughkeepsie, we'll be publishing a phone number and a process for you. It's our pickup, our drop-off program, where you'll get scheduled with Mid-Hudson Regional Hospital for a test. We'll drive you, if you don't have access to a vehicle, we'll drive you to that test location and bring you back. Additionally, I want to mention again, we're launching an aggressive effort to test every resident of a nursing home in Dutchess. We're doing this in concert with Ulster County, and we're working with the governor's office to get access to those tests in order to do that. We're beginning immediately with Wingate and Beacon, and we'll expand from there. We think it's critically important, and it's a value to ensure the safety and protection of those living in nursing homes. We're going to go to, I apologize, I think it's Julio I just want to make sure, he could be Italian, and I just want to make sure it's Julio, regarding renter protection. Go ahead.
Yes, good afternoon. Thank you very much. My question is, given everything that's happening, a lot of renters are wondering how they're either, what their protections are and what are their rights in this subject. Like, for instance, is it legal for landlords to be raising rents or signing lease agreements, or what are they doing since they may not have their employment or income at this point?
Well, so number one, the governor froze evictions. So number one in the state of New York, and again, tenant right land law is within the purview of the state government. So the governor has the authority to act. The governor did act, and we support this. Freezing evictions, so an individual cannot be evicted during this time period. Quite frankly, can a landlord negotiate a new lease? Sure they could. My suggestion to anybody who's watching who's a tenant, now is not the time to feel pressured into signing a new lease. And so I just offer that holding with your current arrangement, to the extent you can financially support that rent, you should attempt to. If you can't, you cannot be evicted. And I would encourage strongly landlords to work with their tenants to be as reasonable as possible. Now, the state of New York is considering a legislation that would, in essence, protect tenants. Now, whether it would waive renter fees, or reimburse for lost rent, that's a decision that the state's making. We think that sort of providing resources to the tenant to pay their rent means that both benefit, right? Or ensuring that those who have lost their income can continue to pay their bills if they're a tenant. That will still mean the landlord benefits. So from our perspective, we think the state should act on broader protections. We want that, but as of today, the law precludes evictions. Dutchess County does have a resource if you need it. You can reach out to us at our COVID hotline at 845-486-3555. We work with Legal Services of the Hudson Valley, Catholic Charities, and others to provide Hudson River Housing to provide assistance. If you need sort of a triage group, we can identify what help you might need, and we'll connect you with support. But no evictions. I would not. I strongly discourage landlords from using this time as a means to pressure tenants into something that neither you nor they can afford to do at this moment. And secondly, I don't think now is the time to be raising rents. However, that is, as I understand it, not precluded, but this is just not the time to do it, and I just would strongly discourage anyone from taking advantage of those who don't have the resources. I understand landlords and tenants both are under financial pressure, but now is not the time to take advantage. And quite frankly, if there are issues of individuals being taken advantage of, there are legal ramifications to that, and Dutchess County does partner with a number of agencies to assist tenants. So if you have a question, dial 0 or add a comment in the live stream. We had a couple questions again regarding the differences between Dutchess County's dashboard numbers and the ones you see online, and then we're going to go to Gloria. So wait a minute, Gloria, we're going to get to you on the phone call. So when you go to the Dutchess County dashboard, you'll see our current data points. Throughout the course of any 24-hour period, agencies from across Dutchess County have to submit tests administered, positive cases, number of deaths. All of this, hospitalizations, all of this gets fed into a statewide database. That then is what Governor Cuomo announces at 11 o'clock on any given day. So at the beginning of any given day, you'll hear the state announce, and you'll see the state information online. Throughout the course of the next 24-hour period, health departments like our own have to validate that information, correct it if it's wrong, and clarify it. And so when you go to our database, you're going to see numbers that are always 24 hours later than what the state releases, or the CDC, or pick one, Johns Hopkins, or Google. But it's always going to be a bit more granular and a bit more accurate because we're spending the time to validate that information. And that's the difference between our numbers and the state number. So they're not static; they change obviously every day, and we're consistently trying to update that. So we're going to go to Gloria. Gloria had a question just regarding being outside. Gloria, go ahead. Are you with us, Gloria?
Yes.
Oh, did you have a question? Go right ahead.
Oh, I'm a senior citizen here.
Yes, you are.
And the benches that is around that we sit on, always sit on comfortably. I'm just wondering now if we can just sit on it same way.
That's a good question. Hey, Anil, Gloria wants to go sit down on a park bench. What do you advise her?
I think if she's not sitting with someone in close proximity, I think it would be ideal.
What about the bench itself? Should we encourage her to go out with a sanitizing cloth maybe and just wipe it down? Or what's the concern? You know, if somebody happened to be positive and cough and sneeze on that.
I understand. Again, it would not hurt, but again, the ability of this virus to be and be sustained and live on things like park benches are not very good. So again, the likelihood that a park bench would be the way that someone acquires it would be very, very low. But again, having an antiseptic cloth and wiping things down would not hurt.
Yeah, and I think that by the way, is really the key moving forward. I mean, listen, we obviously want to get restarted. We want to reopen things. We want to be active and involved in life again. Some of those precautionary steps are going to have to stay with us, and listen, rightfully so, right? So hand washing, use of the hand sanitizer. Gloria, if you can get those Lysol wipes, those sanitizing wipes. If I were going to sit out on a park bench, I'd probably wipe it down. And then take my seat, and then when I get home, I'd make sure that I wash my hands, or before then use some hand sanitizer. Very key, and this is with any disease, right, Anil? Don't touch, if you're touching, you know, if your hands are on the park bench, or you're picking up things off the ground, do I want to put my hands on my face? Anil?
You know, that's a great point, Mark. I think before this pandemic, we never gave thought to the idiosyncratic and the minor things we did day to day, especially we touch our face constantly. But again, we have to take account of what's around us, who is with us, who are we potentially exposing or being exposed to, and the things we touch, the things that, again, we interact with, we always have to have a plan in terms of how am I going to protect myself, what type of hand hygiene am I going to do, am I going to wear a mask? All these things we should be thinking of and planning for actively.
So we had a question regarding, well, as things reopen, will we see a spike in numbers, meaning positive cases, etc.? And the likelihood is we will see new positive cases. Anil, what's the thing we want to worry about when we start reopening? What's the big concern?
It's really the trajectory and the magnitude of cases that we see. If we see the trajectory as it was before in March and in early April, that's concerning. But again, if we see cases, but again, it's not overwhelming our healthcare system, that's a very good sign.
And that's the key. So the key is slow rate of transmission, not obviously minimizing the severity, and monitoring hospitalization. So while reopening and restarting will likely cause transmission, access to testing will also identify positive cases. But if it doesn't translate into acceleration of hospitalization, then that's not as alarming. But we want to monitor those things aggressively throughout. Is that about right?
Absolutely, Mark.
Thanks. I always like when he says absolutely. I almost feel like I've learned something. We did have a question, and I want to answer that came up on the live on the feed. Benita and Marissa are asking about autumn weddings. We've said a lot about what we don't think will be occurring this summer. It is not logical, and I don't think you'll see large social gatherings, and the event planning and activities this summer are going to be exceptionally limited. In particular because you're bringing together populations of people that would mix at risk versus high risk versus low risk. So don't expect to see large concerts, parades, and activities through the summer months, although some of those activities could occur in different settings, but not at the scale and scope we're used to. I think it's believable, and Anil, you can chime in and say I'm utterly wrong, but assuming we don't see the spike in hospitalizations, the fall timetable for weddings and events, again, with some of those physical distancing, limiting some of the numbers and some of the personal protections put in place, you could see those activities, I think, occur in the fall. Does that seem logical, Anil?
It may be a possibility,
yeah.
But again, we really have to be guided by the numbers and metrics.
So if the numbers prove out and we can maintain that low hospitalization and transmission, we could see events like that, but not during the summer, certainly not before fall months. And again, we're going to watch those throughout. And the hospitality industry understands this. It's a big, big challenge. We're grateful to Joe Benora, who's helping to lead our one work group on that. A number of individual business people are assisting us in sort of setting protocols that will help us. I do want to say this, and I apologize if it sounds a bit of a personal plug, but the governor did allow that weddings can occur virtually. And just in case you're wondering, county executives are able to administer weddings. So I'm permitted to officiate a wedding. I come with my own sign language interpreters. Having administered about 50 weddings in my lifetime, it would be the first that we ever did virtually, but I'm not plugging, I'm just saying that I'm permitted to do that. We've got 5 minutes left. Let's get through a couple more questions. Let's go to Jacqueline. Jacqueline, you're a business owner. You have a question? Jacqueline?
Yeah.
Go ahead.
Hello?
Yep, you're right there. Go on. Go ahead.
Thanks. I own intermediate the one in Poughkeepsie in Dutchess County. And I've been following these calls and webinars and staying on top of everything and appreciate all the answers, etc. I'm just wondering, because we're probably going to be one of the ones on the latter end to be able able to open because of the high risk, being hands-on, etc., facials, haircuts, So I'm wondering, how am I supposed to pay my rent for my closed business that is sitting there right now, not being used? Is there going to be some sort of rent subsidy program where we are reimbursed, or because my landlord is saying, being flexible as far as letting it go for a little while here, but expecting all of it. And I don't know, you can't draw blood from a stone, so I'm just not sure where that's going to come from, and especially because we may not be able to open until who knows when, maybe August, I don't know. So I'm just wondering about rent.
Yeah, and you're not alone, and believe me, it is, the devastation economically is real, and you are right, your industry is going to be sort of limited, and when you can reopen will be a little bit later. I'm hopeful that it's not August. I'm hopeful it's before then. Number one, I will say this, I mean, I don't know if I know your landlord, but this is not the time to take advantage. So from a landlord's perspective, we understand you're under stress too, but you can't get people to pay for something they can't afford. The money's not coming in, it's not coming in. So number one, some businesses do qualify for the SBA loans, and again, you may not be one of them, but you should still reach out for unemployment insurance and SBA loans. If you have a question regarding that, you can reach back out to us at DutchessBNN.com, DutchessBusinessNotificationNetwork.com. We believe the federal government will in the next set of bailouts, if you will, or stimulus packages, include some benefit that directly gets to businesses and addresses the inability to pay that rent. I would also say to the landlord, you can't, evictions are frozen now. I don't know who's going to take up a space, and so creating a problem for your tenant now is just probably going to be a long-term problem for you as a landlord. So we hope that they give you the relief. In the meantime, we're advocating for state and federal relief on rent in particular for residents and small businesses, and saying basically either reimburse the tenant so he or she can pay the bill, or somehow provide a benefit to the landlord and the tenant so the cost is minimized, and you're not forced in 2 months to have to pay the last 4 months of rent, certainly all up front. So if you have a question directly about that, we can provide you help. DutchessBNN.com. Our team is here to try to assist. We believe the federal government is going to have some relief in that regard. I can't imagine the stress, but hang in there. They're working toward it. So we on the telephone town hall, we're going to wrap up. We have you only until 7 o'clock. Why don't we? Is there any last question on social media that we want to take? I want to thank you on those of you on the town hall now. We remind you that we do a town hall every Wednesday. So next Wednesday, May the 6th. Next Wednesday, May the 6th, we'll be live on Facebook. The next telephone town hall and Facebook live town hall will be Wednesday, May 13th at 5:30. We will be here every other Wednesday for the foreseeable future, even as we reopen. The goal is, as we restart, as we reopen activity, we're still going to be here communicating with you, so you can continue to ask the questions. We can give you answers every other Wednesday live on Facebook and telephone town hall. So the next Facebook live is May 6th. The next telephone and Facebook live is May 13th at 5:30 p.m. I want to thank you for being on the telephone call. Any last points on social media? When is it going? What is the new normal? Well, that's a good question. Why don't we wrap up with that one? This is a little bit of the new normal. This is a little bit of the new normal. The truth of the matter is that we're going to have to employ steps to engage in physical distancing. We're going to have to employ steps to ensure that we're not transmitting the disease with the use of a mask. We're going to have to ensure that we're limiting sort of that interaction for the foreseeable future. But the other new normal, assuming that we can overcome the economic devastation, and again, for some people, this is going to feel like the Depression, not only a recession. But for those who are but if we can get out the other side, if we can see daybreak, if we get out through the other side, and we will. We think maybe the new normal is we're a little bit more focused on each other, that there might be a little bit more sensitivity to families and the need to interact with our kids and those who might be struggling. There might be a heightened awareness that we have family members, seniors, friends, neighbors who need help. and that perhaps instead of, in some cases, waiting until there's a crisis or an emergency to engage, to react, to interact, perhaps, just perhaps, we might find ways to do that more regularly. I can tell you, my wife hopes the new normal is we don't go back to fundraising events and social events every night of the week. And I think that there's some validity to that. You know, let's try to find time with one another. I can't begin to express how thankful we are to everyone for your patience, to our teams for working so very, very hard. We absolutely are praying and are hoping for those of you who are struggling very, very, very hard financially, small businesses that are worried whether or not you can open your doors. I'm telling you, we're going to fight for you every single day. We're going to fight to make sure you get the help you need from the federal and state government. We're going to try to move what obstacles we can at the county level to make it easier for you, and we're going to work damn hard to ensure that the residents of this county have the support and the resources that we need to get back up on our feet again, and we will. As the video started before this town hall, we will fly again, and we're beginning the process of restarting Dutchess. So thanks very much. We'll see you again in a week.